Now, according to the World Health Organization, suicide is the fourth leading cause of death among 15 to 29-year-olds in Nigeria. But the problem goes beyond this group and affects every age range in the country. And deteriorating mental health conditions appear to be mostly responsible for this alarming statistic. For years now, my next guest, Angela Brown, is a nurse by profession, has taken the issue of the mental health of Nigerian youths very seriously and has been working on mental well-being, resilience and suicide prevention in this country. She is the co-founder of the Land Health Initiative, an NGO that promotes wellness and health education in Nigeria. She's been warning that the scale of mental health problems in Nigeria is reaching epidemic levels and that it is time for the government to step up action by several gears. With more on this, I'm joined now in the studio by the co-founder of the Land Health Initiative, Angela Brown. Angela, thank you very much indeed for coming.
Thank you.
What does LAN, what does it stand for?
Well, LAN is actually the initials of three women that came together to, to start up the NGO.
Right.
And it's made up of three women, myself and two other ladies, medical doctors by profession. And LAN is made up by initials. So there's Dr. Lutachukwu Moneke, which is the L. There's Angela Brown, which is the A. And there's Dr. Nkechi Mbezue, which is the N.
Okay, well, we've got that. Let's get to the meat and potatoes of this, because according to you and according to the World Health Organization, there's a mental health crisis in Nigeria. Tell us more.
Definitely. Mental health is so ignored in Nigeria, and it's really, really a pandemic, if I have to say so myself. And the problem is that mental health comes with so much stigma, and people are not able to address these issues adequately. You can't, because in Nigeria, the last mental health law was 1968, which is the lunacy law that is so outdated. And, mental health, when people talk about mental health, they think mental health has to do with somebody who's mad on the street, or somebody who's just not okay. But mental health affects everybody. And that's what people need to realize. If your mind and if your headspace, like they say in the US, if your headspace is not together, you can't really be productive. And that's what a lot of people don't understand. And so here in Nigeria, you're finding a lot of the youths are on drugs. And due to that, their mental health is not adequate. And not just the youths, a lot of grown-up people. When I mean grown-up, we're finding out that the drug use is from ages 8 to 65. And because of that, you have most of these are normal people, most of these are people in the government, most of these are school-age kids. So it's like you find out that a lot of these people are going through issues. And with drug abuse comes a lot of...
It exacerbates it.
Yes, it exacerbates your mental health issues. So we find out that this is so ignored. The government really needs to do something because we are in the stage that a lot of these youths are just not functioning
Well,
properly.
you said the government needs to do something. What kind of senior level attention is this issue of mental health presently getting here in Nigeria?
It is just, it's horrible. It's horrific. And the government we need to have more awareness. We need to have more advocacy. We need to take mental health seriously. It's devastating.
When you say seriously, I mean, does the government actually have a mental health strategy in Nigeria?
I don't think so. If there is, I don't know. The law was just revised in January of this year. And mental health is still very ignored because people are not aware. And we're having to deal with a lot. Right now, Land Health Initiative is counseling over 300 youths on mental health. A lot of them are having issues, and there's not enough There are not enough psychiatrists, psychologists, licensed psychologists to go around to help these people. And then the cost of it is so, unaffordable.
Right.
So people wouldn't even get it. So the government needs to do something. They need to invest in advocacy. They need to invest in helping these people, because in every household, there is somebody that knows somebody on drugs or dealing with mental health issues or has committed suicide. So we really need to take this very seriously, because this is very, very bad.
And are there areas or regions in Nigeria where the mental health problem is more acute, or where rates of depression or suicide are unusually high?
It is in every state. Yeah, you can't really narrow one state down that's where it's predominant. It's really predominant everywhere, because the high incidence of drugs, trauma, societal issues is in the whole of Nigeria. So really, it's predominant everywhere.
Right. So what are the challenges that you face in doing this job that you're doing?
We face a lot. So one, we face funding because we're self-funded. We also face a lot of corruption, because what's going on is, if you're a lot of the nonprofit organizations in Nigeria are, majority of them are not really doing what they're supposed to do. They're more fraudulent than anything else. So getting funding or getting the higher international bodies to take interest in you find out that you're doing so much. And then also, if you're trying to secure funds, you find out there is a hindrance, because, where you're trying to secure funds, there's a blockage, because the people there are either looking for money or trying to get you to do things that are not proper to be able to secure those funds. And then the people you're trying to help have been disappointed so much, which is the people, the disenfranchised people, the people that need the help, that they are now looking for monetary compensation for you to even treat them, or for you to give them what they need. So these are the challenges we're facing, and it's really hindering a lot of things that we're doing.
So what about things like suicides? I mean, how bad is that in Nigeria?
Suicide is so bad. Nigeria is so underreported. In 2017, I think Nigeria ranked 3rd in suicide in the world. There's a lot of suicide going on
in the world.
Yes, there's a lot of suicide going on right now in Nigeria. It's so underreported, not because, number one, suicide with the lunacy law is like a crime. So a lot of people will not report because of the stigma. A lot of people will not report because of shame. A lot of people will not report because they're not aware of what is going on. But suicide is so high among ages 15 to 29, based on research. And it's due to drug use, it's due to, this generation called the Generation Z. They've seen a lot, they've gone through a lot, they're very fragile. So there's a lot of suicide going on with those ages. And it's really very rampant in Nigeria. We just had a case of a Nasarawa State University student that committed suicide. We were there in their law school educating them on mental health and suicide and drugs and depression. And it's really sad, because I think the universities and the higher institutions need to do so much to create this awareness, because these kids imbibe these drug habits and imbibe all these issues while they're in this higher institution. So a lot needs to be done to create awareness and teach children, what you can do to get help.
And you think a lot of the suicides is as a result of mental, because obviously depression is a mental health problem.
Yes.
But also drug use and that sort of
use,
thing. Yeah. So really, in terms of a solution, there needs to be a bigger budget from the Nigerian government, recognizing that this is a real problem.
Yes.
With planning based on robust data.
Yes.
But also presumably some philanthropy in this area.
Yes, definitely, that's much needed. The biggest thing for me is that the Nigerian government needs to really wake up and understand that this is a problem.
You're right.
You can.
It's a crisis.
It's a crisis. You cannot. We're looking at the future leaders of tomorrow, and if they're all messed up in the head, who's going to lead? We have to really think about
Right,
that.
no, absolutely.
You
That's
know,
an important point.
and we have to preserve what
we've
we
got about
have.
a minute left. If there is someone out there who is watching this and is struggling with mental health issues or suicidal thoughts, what should they do? How do they find support?
Well, unfortunately, there's not a lot of support, but we're here. Land Health is here, and you can reach out to us, and you can call us, and we'll take care of you.
And you're on the internet, of
Yes,
course.
we are.
Okay, look, I want to thank you very much indeed for taking the time to come and talk to us and talk to us about this very important issue, and to commend you for the work that you're doing there.
Thank you so much.
Angela Brown is the co-founder of the Land Health Initiative. Thank you.
Thank you.